Representative Anna Moeller, thanks for joining us again on the Illinois Channel.
Oh, it's my pleasure. Great to see you.
One of the bills that's been moving through the legislature this year concerns how many patients a nurse can handle. And there's been the complaint over the years that they are over-assigned. And sometimes, if someone just has some bronchitis, maybe they don't need that much attention in a nursing home, but someone else might have a severe case.
Right.
So what happens, according to some of the nurses, that they're not able to give good care to anyone because they're assigned just way too many patients.
Exactly.
So, as I understand, you're working with legislation concerning this. What would it do? And just give us the details, if you might.
Well, there are three main components to this bill. The first is that it requires informed consent from nursing home patients in the administration of psychotropic medications, so that patients are aware of the drugs that they're being given and that their families are part of that decision-making process. Secondly, it goes to the point that you mentioned, ensuring that staffing levels are adequate to provide high-quality care to our residents in these facilities, and that our staff members are working in safe and healthy working conditions. And then third, it gives workers the ability to negotiate for these issues and for conditions that affect their work environment.
So on the, I may not have this phrase right, psychotropic, what is it?
Psychotropic.
Psychotropic drugs. Am I understanding that what might happen is that some nursing homes might basically drug the patient so that they're not as demanding and easier to handle because maybe they just make them sleep a lot during the day.
Yeah.
And if that's okay with the family and okay with the patient, that's one thing.
Right.
But you don't want them to be having been drugged without their knowledge or just against their will.
Exactly.
Have we found out, is that happening? I mean, how much? What background is there that I can imagine some of the nursing homes might say, we don't need this legislation, we adequately staff and take care of our patients. Is there evidence to support that this is needed?
Yes, there is evidence. There have been studies that have shown that patients are being overprescribed and overmedicated in certain circumstances. And just as good public policy, we just want to make sure that patients in these facilities maintain their integrity and their rights and are able to control the types of medications that are being administered to them.
And joining us also, Lorie Hendren from AARP of Illinois. And Lorie, let me ask you, AARP is supportive of this bill. One question I have when we talk about staffing levels, what constitutes a staff under this legislation? Is it just someone who doesn't have a medical background and lifts someone in and out of bed? Is it an LPN? Is it an RN? How would we count this?
So what we're looking at here is for minimum staffing is what was agreed upon in the law in 2010 for nursing home care for intermediate and skilled. And we want to make sure that is up to, is essentially met. And that's where the challenge has, since this bill in 2010, there was staging of the increasing of staffing. And since that last stage, we have found, even with the expose in Chicago Tribune with Kaiser Health News in the fall, we are finding nursing homes aren't staffing to that level. So we are just making sure that, with this law, this is protection of residents, and with the leadership of Representative Moeller and Senator Collins, they're understanding it. They're hearing from constituents in their communities and also workers in nursing homes of saying, we just can't do it all without being the opportunity to be there to work. Yeah.
I'm anticipating what some of the criticisms might be from the nursing home industry. A lot of them are paid. I mean, it's so costly, I don't know how anyone can pay for nursing homes, but I mean, a lot of people that are in it end up being paid by Medicaid. They wipe out their own resources and then the Medicaid kicks in. The problem with Medicaid is it often pays poorly and late. And so the nursing homes are going to say, you're raising the cost of our operations, but we're not going to get paid anything more from the Medicaid system. Is that an issue? And if it is that a legitimate complaint?
Go ahead. Would you like?
Sure. Well, there was a bed tax that was implemented a few years ago that went directly to the nursing homes to help pay for this care. And the concern is that that money has not gone into hiring more staff and increasing the level of care for the patients in the nursing home. And there have been requests for increased funding, reimbursements for Medicaid to our nursing homes. And we want to be sure that if we're going to increase funding, we acknowledge that their funding is always an issue and is necessary, but that there is some accountability that's coming with this additional funding from the state. And so this bill bakes in that accountability to ensure that the money is going where it's most necessary, and that's in patient care.
How do we know on compliance? How do we know if we pass the bill that it's being followed? Is there any mechanism in there for reporting from staff?
Yeah, our Department of Public Health is responsible for monitoring and ensuring compliance with all of the regulations that apply to nursing homes. And so if residents or family members have concerns, that's the agency that ensures that nursing homes are complying with the regulations. So yes, there will be oversight to ensure that these regs would be met.
And I think everyone understands the intent of the bill. I mean, you have, we've heard horror stories over the years, different people not being cared for properly,
right,
and warehousing people. I don't want to paint all nursing homes as the same, but just like not all garage mechanics are the same, we have some bad actors in every field. So is there, if this were to pass, is there a sunset provision? Is there any methodology to review it at some point and say, is this working properly and let's tweak it, or is it kind of a fixed in legislation?
I want to answer. Right now, we are AARP, SEIU in the nursing home industry. We really are sitting down and talking in good faith, listening to both sides. And the mechanisms is that, one, we have it in state law, and there will be reviews. And so I think it's important because we have surveyors that go through nursing homes, and they will be able to see if these minimum staffing is being handled. And with the measure, there's accountability. So, as well as informed consent. So we are working in good faith to try to work through some of those issues. Yep.
Okay, good. Well, is there anything else we need to?
I would just add to this is that we recognize, I would say AARP does, we all need to age in place. I would love for everyone to age in their home and community, but there are points in our lives where the being in the setting of a nursing home is important. I can speak on behalf of my family, but at the same time, Illinois passed a law in 2010, and we need to uphold it, because from 2010 to 2019, we haven't zoned in on that informed consent, and we've seen the minimum staffing not being held. So at the end of the day, we can continue talking, or we can have champions like Representative Moeller and Senator Collins that can stand up and be the voice for the residents and the workers. In the end, be able to make sure when residents are able to go to bed at night, they know the care is there and their loved ones. Because at some point, we need to be entrusting that we can rest with ease.
Right.
Yeah, I mean, for obvious reasons, we get someone who's a parent or a grandparent. It's one thing if they're just getting old, but something else if they have Alzheimer's,
right,
in which case you really can't care for them at home anymore at that
And
point.
that's
Right.
understandable.
Right.
And we don't want to be worrying about what's happening to them when they're
Exactly.
at the nursing home and we're not there visiting, just to make sure.
Exactly.
One last thing is you just touched on, again, on compliance, if they weren't following the 2010 law, how would we know to enforce this? Is there any?
So with this, the language that we have right now, we're looking at the payroll data from the federal CMS, looking to see about the staffing, and ensuring the Department of Health can be able to look at that for accountabilities as more. So we're opening up some transparency, seeing some information that's already being gathered, and using that as a tool. Right, and then also there, for minimum staffing, there is violations, and then there's also a posting. If you fail to meet the minimum staffing, there has to be a posting at the nursing home. But the beauty of it is, if you're a nursing home doing right and hitting the minimum staffing, there's no posting. So, yeah.
Well, ladies, thank you for joining us. We'll follow that
Thank you so much.
Our officers.
Jeff Berkowitz, thanks for joining us on the Illinois Channel. We're going to take a bit of an in-depth look at the run for the mayor of Chicago. I think what they care about are the issues we're talking about. What are you going to do about the schools? What are you going to do about fixing the financial situation of the city? And what are you going to do about the level of crime and ensuring that we have safe neighborhoods? Would I be right on that?
And frankly,
Yes. The Illinois Channel, keeping you connected to your state, your issues, your home.